Thank you for having me. I'll try and switch back and forth if it's comfortable. Mình tên là bác sĩ Lữ ha. And just a brief intro. I was born in Vietnam, lived in Vietnam for 10 years, came here and lived in Orange County for most of my life until I went to Missouri to study for med school. And then I joined the Navy during med school, and that's how I stationed back here in San Diego. And my military career brought me to have a specific interest in psychiatry. I was very happy with ER medicine and surgery, but psychiatry really spoke to me in seeing how all the military people were suffering from a lot of combat stress, especially in our own country that still needed help. So that was something I had a calling for and I really found interest in. So I specialized in at UCSD. And then after I got my psychiatry residency, I continued working with the Navy as a civilian. And then I transferred to the VA. So I'm over at the VA right now as a medical director for a facility that takes care of veterans who have struggled from PTSD and come back from deployments way back in 2000 to now, 25 years past, and they're still suffering. Loss of family, loss of jobs, loss of identity, and loss of home, and basically homeless. And this is their life now. And we take them from all over the country. We keep them for 6 months, and we just work from the ground up in fixing all parts of them. In the therapy part, right, the psychiatry, I do the meds. My PhD psychologist does the therapy, but I oversee. And then I also have a chaplain, a pharmacist, a primary care doctor, a nurse, a social worker, and volunteers. And with this whole team, we fix as best we can to give this person a new opportunity in life in the 6 months that they're there. Get the therapy going. You got to talk about your trauma. Get the basic needs: food, shelter, clothing, jobs, money, education to restart life and to give purpose and meaning again. If I treat you and you're doing well, what would you be doing with your life? And how are you going to maintain that purpose and meaning? And that's usually the thing that it's working, when a person finds purpose and meaning in their life again and not feeling like I'm just here to waste time and waste my life away. So that's a little bit about me. I love talking about psychiatry to anyone and everyone, but specifically to our Vietnamese community. As we know, there's still a lot of knowledge gaps, right? Or misconceptions about it, right? We often think that's for the crazies, right? And anyone who sees the word tâm thần, right? This word to a Vietnamese does not sound as simple as psychiatry. It actually implies that I'm crazy whenever this word comes up. It doesn't mean mental health to them, right? Tâm lý is psychology. So if you see the word bác sĩ tâm thần, that means MD or DO, right? And we give prescriptions and we do therapy, okay? And for tâm lý, bác sĩ tâm lý, that's the PhD folks, and they do the talk therapy. This is their specialty, okay? They don't have to worry about blood and all that stuff and meds and stuff. We do. But these two work together. People often ask, like, where do we start if we have someone in the family that needs help? We're not sure. Where do we go? And they often mistaken the two. My personal opinion, because this takes over 13 years to me of training. I got 4 years of undergrad, 4 years of med school, 4 years of residency. That's 12, plus something I wanted to do special in learning what the psychologists were doing while I was going through psychiatry. So I just combined everything into my own skill set. This one, if you just went traditional straight through, you could probably do it in 5, right? So the training is focused on just psychology. We're talking, we're fixing through therapy. This one, I have to think through your psychology, but also your meds component, right? Is there a depression picture going on here that needs antidepressants? Is there an anxiety component here that may need anxiety meds? Most people are scared the minute I mention meds. It's like you're trying to push meds on me, right? But it's actually the physiology. If you have high blood pressure, if you have high cholesterol, and you need some kind of push to change that cholesterol and change that blood pressure and change that diabetes, do you judge yourself and saying, I need diabetic meds, I need hypertension meds, I need cholesterol meds? Does it feel like you're a bad person if you take those meds to help your body to get back into a healthier state while you're still doing diet and exercise? That's probably the ideal combo we want. Until we get to the goal of like, we're healthy, happy, and non-diabetic, blood pressure controlled, and cholesterol now normal. That's the goal. The same goes for mental health. There is a set of serotonin and other neurotransmitters in your brain, and it doesn't quite add up to anything else, physiology, genetics, life, nature, nurture. It's going to come out, your brain is going to be different. You're going to be super strong in something, you're going to need a little help in something else. And depending on the environment you're in, that kind of shapes where you are in your life and how it carries you through your life, and how I hear your story to know what perhaps you may need to get you into the spot that you want. Here's where I am: depressed, anxious, scared, don't want to do anything, or maybe bipolar, schizophrenic, and I hear voices and seeing things, and I'm just not living in a way that is compatible with society and for myself, right? If I hear that story and I want you here and you want to be here, what do we do to close that gap, right? Meds and therapy, okay? So the two combined, but I would start, for me personally, I would recommend starting with an MD or DO to get the psychiatrist's whole picture, to just make sure, do you need the meds along with the psychology? I can always refer you down to this person, but this person, in my opinion, may kind of take care of you in that with perhaps, they do refer back up when they know, right? But sometimes there's a little gap in between. And so this you just get right off the bat. So that's a personal take on it. Any questions so far? How we're going? You want me to do more Vietnamese or just English? Go in Vietnamese? Okay. Alright. Mình bây giờ nói tiếng Việt hơi ngắn gọn lại là đây là bác sĩ tâm thần, bác sĩ tâm lý. Bác sĩ tâm thần á, là có chuyên khoa về cái viết thuốc, toa thuốc cho những bệnh tâm thần, và cộng lại học thêm được những cái tâm lý để mà khi mình nghe cái chuyện của người bệnh nhân á, mình biết là người này là cần những cái gì trong cái sửa chữa và cái chữa bệnh ha. Nếu mà một người mà có thể mà trầm cảm thì cái đầu của mình nó nặng nề, nó không có muốn là đi ra ngoài đường, muốn ngủ nhiều, hoặc là cái sức của mình nó nhiều khi cái đầu mình muốn làm nhưng mà cái sức của mình nó yếu quá, như là một cái cục pin nó hết pin rồi vậy đó. Và ăn uống cũng thay đổi, ngủ cũng thay đổi, và có chán sống, và có cách mà cũng như nghĩ rằng là tôi là một người thiếu tự tin, and những cái đó nó làm cho mình cảm thấy như là rất là mặc cảm và không có cảm thấy như là muốn làm gì thêm đó. Thì khi mình nghe như vậy á, thì một phần đó là mình dĩ nhiên là có một cái tủ thuốc ha. Không phải là ai cũng phải cần thuốc, nhưng mà tùy theo cái kinh nghiệm mình nghe cái trầm trọng nó cỡ nào á, mình phải cần một phần để mà viết cái toa thuốc đó để mà nâng đẩy lên những cái chất serotonin, cái chất mà nó làm cho mình đó là chống lại cái trầm cảm á. Tại cái chất serotonin càng có nhiều trong đầu á, thì mình càng chống lại những cái stress của đời. Nếu mà mình thiếu cái chất đó thì cái chuyện thường nó cũng có thể thành nặng nề quá, mà cái chuyện lo âu á, nó nhẹ như vậy nhưng mà nó cũng thấy là rất là bự. Cho nên mình phải làm lại làm sao mà cho cái độ của nó đều là ngay cái phần mà cũng như là làm được, không phải là nặng nề quá, depressed quá, mà không phải là lo âu quá mà cũng không có muốn làm gì. Phải cho cái đường ở giữa đây, đường đời nó ở giữa đây á, thì mình lo được. Mà quá cao quá thấp rồi nó làm người ta không có muốn đối phó với nó, thì cái đó là mình nghe để mà mình biết được cái độ trầm trọng tới cỡ nào để mình cho thuốc. Còn phần tâm lý á, là có lẽ một người nói tôi cứ gặp cái loại người mà tôi không ưa, mà tôi không biết đối xử như thế nào, mà tôi đi làm á tôi cũng bị, mà tôi đi trong cái chuyện gì nè, xã hội xã giao này kia với bạn bè, hay là trong chuyện tình cảm á, tôi cũng bị, mà lúc nào tôi cũng bị thiệt thòi, lúc nào tôi cũng bị là cũng như là người không hiểu không biết chuyện, hay là tôi bực với người ta xong rồi cái bắt đầu đẹp nhưng mà nó cứ tan vỡ ra đó. Cái đó là nó vì sao? Cái đó chưa chắc là mình phải uống thuốc, nhưng mà cái đó là cái tâm lý để mình hiểu được cái biological, psychological and sociological. Ba phần của mình là phần sinh lý, là physiology, là khi mình đẻ ra con người mình đã như thế nào và đầu óc mình đã như thế nào, máu này kia đó, rồi cell DNA này kia đó là phần biology ha. Psychological là phần tâm lý, right? It is your way of interacting with the world, the way you understand the world, the way you solve your problems in the world using your psychological templates of this works for me, this is my personality, this is what I do. Đây cũng như là một cái cách mà mình đối phó và đối thoại với lại những người trong đời mình. Tùy theo cái khả năng của mình và tùy theo cái môi trường của mình, lúc mình lớn lên trong môi trường nào, mình thấy được những người chung quanh làm như thế nào và mình có thể dùng cái ấn tượng đó và bắt chước như vậy làm lại. Một người trong cái môi trường này có thể giải quyết một cái vấn đề một cách là la lớn hay là đánh này kia nọ. Một người thì nói là chỉ là nói chuyện thôi. Tùy cái ảnh hưởng của họ trong đời. Psychological, cái đó là cái template và cái mẫu để mà mình đi trong cái đối thoại với người ta. Còn sociological là cái xã hội ha. Cái này là nội tâm của mình, còn cái này là xã hội, mình phải interact với người ở ngoài, right? So khi mình đem những cái này của mình á ra ngoài á, nó như thế nào? Mình khi mà mình bực hay là khi mà mình buồn hay là khi xã hội làm khó mình thì mình interact nó như thế nào để mà mình vẫn được giữ cái sức khỏe tâm lý tâm thần của mình và mình đạt được những cái gì mình ước muốn, và phải làm như thế nào để cho hai cái nó ba cái nó đều là cũng như là in balance, cân bằng và phát triển. Okay? Does that make sense? Okay. Let me pause. Có ai có câu hỏi gì đặc biệt về phần tâm thần tâm lý mà muốn biết thêm để cho mình nhớ để mà mình trả lời trong cái thời gian mình có? Còn không thì mình cứ sẽ nói tiếp tục theo những cái mà cũng như là most common, như là communication, cách nói chuyện và cách cũng như là giải quyết những cái vấn đề hay là những cái khó khăn. Các em có thể hỏi là các em trong cái cuộc sống của các em ngay bây giờ, cái gì là stressful nhất cho các em để mà mình biết là mình có thể phân tích ra phần này phần nọ. Okay. Any questions?
Dr. Liu,
Yes.
isn't serotonin, can't you get that through just hugging people?
Through?
Hugging people.
Yeah.
Eating bananas?
Eating bananas?
Turkey.
Oh, tryptophan, serotonin. Yes, not unreasonable to think that. Biologically, giống như mọi người mà mình nói là high cholesterol, high blood pressure, naturally, biologically, there's a certain extent that you can diet and exercise to get to the healthy state, but there are some biologically that, in addition to doing all that, the cholesterol remains super high, and you need, cholesterol meds and anti-hypertensive meds. To me, biologically, serotonin is the same way. You can get those from turkeys and doing. The good thing about P1, P2, and witness. This is an interesting thing about serotonin and good deeds. If you do a good deed for this person, it says your serotonin level goes up. If the person who receives the good deed, their serotonin also goes up. What was interesting was, as a witness to this interaction, their serotonin also goes up. So paying it forward, doing a good deed, helping and creating community of, support, you can do that. It does help. I don't know quantitatively how much of this on its own can level up to a person that I would say, this is on a level of moderate to severity, and it needs a little more than just your light application. So answer is yes, you can get it. Is it enough to get you out of the state of, where you're at? So moderation in all the things and how to work through the understanding of mild, moderate, severe, and application of various treatments to match that. That would be the best way to say it. Yes, Keith? Yes. Yeah. Okay. The question is, can I talk about mental health and ADHD? What does everyone think about ADHD? Khi mình nghĩ tới ADHD, mình nghĩ tới cái gì? Các bạn biết ADHD không? Attention Deficit and Hyperactive Disorder. Okay. What does that mean? Have you seen anyone with it? Have you experienced it yourself? And have you learned anything outside of all that from just outside? What's everyone's kind of broad strokes knowledge of that? Yes.
I can share. My roommate has ADHD.
Okay.
And it's obviously it's not something great to have, but it's kind of funny sometimes because she's really forgetful.
Mm-hmm.
And sometimes she'll like often repeat things that she's
Mm-hmm.
told me before.
Mm-hmm.
So I don't know if that's a symptom.
Mm-hmm.
And she can sometimes either be like really tired
Mm-hmm.
or like get sudden bursts of energy.
Mm-hmm. Mm-hmm. Okay. Anything else? Yes. Mm-hmm. That's the main one, right? Yes. Yeah. Okay.
Yes, I actually do have ADHD,
Okay.
and sometimes it's really hard for me to completely pay attention or get things done.
Mm-hmm.
So if I get have homework, for example, I will do it,
Mm-hmm.
even though I'm doing it, I know how to do it,
Mm-hmm.
and still get started. Nor can I
Mm-hmm.
nor can I complete it if I am interrupted.
Mm-hmm. I'll call it activation. Okay. That's good. All right. I just want to repeat what's your name? Kevin? Okay. Kevin just said a few major things there. Okay. It's not that I don't want to do it. Just I have a hard time maintaining my focus to get it done. Right? It's not that I don't know how to do it, but to find the activation energy to actually stay on task and complete. This one, imagine how the teacher hears it or the teacher perceives it. Thường thường người thầy cô mà thấy một người không làm bài xong, một người không có giống như các em khác, cái thầy cô đó nghĩ gì về các em đó? Right? What are some words? Right, right. That's the stigma, right? That's right there. Right. That's the starting point for a person. That had nothing to do with, work ethics. I hear the person saying they want to do it. I hear the person that wants to get it done, but it's just something is in this between here and getting things done. There's this gap right here, right? And that's all these things. But the teacher is hearing this. What about the parents? Do we say that too? Right? Very much so. Now we got a times two. All right? And imagine hearing that every day. What does that do to your own? How do you feel?
I lived this, so I feel terrible because, like, am I wrong? And it also doesn't help that I'm also autistic, so
Mm-hmm.
it's a comorbidity, so it happens.
That's really brave of you to say. Thank you for sharing that. And thank you for acknowledging and being aware. I think that's really, some people take a whole lifetime to say what Kevin just said. We just don't know. There are doctors out there, doctors in their 40s, 50s, still coming to my wife, who is also a psychiatrist, and she loves doing this. She'll be like, this is the first time the doctor is realizing they have that all their life. Lawyers, bankers. I had a patient who was a banker who got promoted. She was doing so well at level 2. When they've promoted her to level 3 in a higher leadership position, she missed 1-0 and it cost them 1 million. 1-0. That was all it was. And it was this, right? Wow, right? So there are hardworking people who mean to do everything they can to do well, and yet it still is a big impairment in their functioning, which translates to, I feel terrible. I'm a bad person. I didn't do this right. I suck, right? All that negative self-talk. What does that do to one's self-esteem over time? Not uncommon to have this tied in with other mental health diagnoses because of it. I would be depressed. If you're telling me I'm lazy every day and I'm feeling like I want to do things every day, and the two of us don't understand, not hard for me to just stay in my lowered self-esteem mode because I can't get things done. That's the final result. That's the thing you see out of it, is that you see me not finishing my homework, right? So how do we do what we do to help process this, work through it? Oh, I know that guy.
Bác sĩ Đức, before an example to share, I just want to share with you one of my best friends. He's the chief of innovations at school. He's also a little schizophrenic,
Wow.
but he made it all the way to be the chief innovations of Google. But every day is a parade and a struggle.
Yeah. It is, some of the most incredible people have this because they know how to play it to their strength, right? You have to know the environment you're in to find the most fitting environment for you to thrive. It's like that example of the oak tree being planted in a pot. You're always going to think you're a small, undeserving small tree if you don't have the environment to be that big tree that just covers and protects everything and everyone when you actually are at your full potential. But there are other trees that won't do well in the open land, and it needs the pot, and it needs a very different type of soil, sun, and care. You have to know what is the type of tree that you are, right? I can't expect a 4-cylinder car to do an 8-cylinder work. If I see an 8-cylinder car doing 4-cylinder work, I'm going to wonder what is the gap to get back up, right? But if you push a 4-cylinder car to do 8-cylinder work and you're saying like you suck, that's going to make that 4-cylinder car, even running on all 4 all the time for hundreds of thousands of miles, to feel like I've never done enough, right? So, thief of joy? Yes. This, oftentimes, it's difficult because you have to be sensitive to where the person is coming from, and you have to know what else is in the story. Because not only, I hear in a person who genuinely is looking for ways to help change that. And I counter with some of the other stories of like college students. Love partying, right? And then to the very last minute, I can't stay up to study. I need to stay up and study. I'll go and say that I have ADHD so I can get a bunch of Adderalls so I can stay up in a week to study. And then I'll get all kinds of like excuses for why I need this medication. You can't look it up, how to talk to your doctor to look like you have ADHD. What am I going to do, right? I got to hear that story and then make a decision in, is this a valid clinical presentation or is this a misuse of a medication that is intended for someone else who's genuinely struggled with this? Now I got a guy who's partying and getting to use that versus a guy who really needs it and he's having a hard time, and we got to make that decision. So I don't know if that helped answer your question about ADHD and mental health. It impacts your depression possibility, it impacts your self-confidence, and it impacts your work performance as well. There are ways to do it with non-meds. You treat it with consistency, schedule, routine, structure. Same thing every day. Decrease the brain amount that you have to do differently. I brush my teeth at 6:30. I get, this done at 7. I'm out the house by 7:30. I'm in my chair at the office at 8. It's routine enough. I can count down to the minutes. If I'm like late for 1 minute here, I'm going to be late for 1 minute here. It is so predictable. Why? If you do that, your brain has one less thing to think about. You just fall into a habit and a routine. And that is your strength. Your habit becomes who you are, by the way. Choose your habits wisely. Okay? There's a book, Atomic Habits. I teach this a lot. I believe what it really does for people. James Clear. If we have, a few more hours, I would totally talk about Atomic Habits. Thói quen sẽ thay đổi, không phải, thói quen sẽ là quyết định cái bản chất của con người mình như thế nào. Your habits actually defines your identity. Scary to say, but it's what you do every day, moment to moment, that adds up to who you are. Moment to moment. Yes. Consistency, structure, routine, and just habit forming every day. Same. Lower the amount of variations. I wear the same clothes every day. It's just like, I pick it out and it's the same. All right. I don't have to think about it. It's the same. Same. All right. Just don't have to worry about variations. The less and the more automatic you make things, the less variable you can do things, the easier your problem solving becomes. Okay. And then there are other habits like, make the calendar your best friend, make your phone alarms your best friend. Just set your day down to a 15-minute chunk, 8 o'clock, 8:15, 8:30, 8:45. Seriously, live your life in an organized, predictable manner. It decreases your level of stress in problem solving a whole lot, okay? Meds wise, of course, there are non-stimulant meds, right? That could help. And they do both depression and focus concentration, or focus and concentration without the effects of what Adderall does. Adderall is the most common known stimulant. The downsides of Adderall is good for the things that it does. If you are truly in need and you take the med and you see a life change difference because this person now gets things done, right? No longer failing tests because they're focused on the question. From the beginning of the question of the test to the end of the question of the test, it says all the following are true except, you love those test questions, all the following are true except. Most people blank out on that word except, and then they pick the true things out of these. I was like, why did I pick that? It doesn't make any sense. I should have picked an except, right? Reading the question, focusing on how I talk, finishing the sentence, not interrupting the person. All those things are very socially challenging for a person who struggles with focus, right? I'm too hyper. I just want to jump in and answer your question. Before you can finish the question, I raise my hand. And I was like, I can finish your sentences and everything, right? And that creates a very difficult social interaction for people. And then soon, this person gets less and less of it because people just have this expectation of norm in a way, and then it alienates some of these behaviors that it's just the person's repertoire in a way. So you start with non-stimulant meds, and if you can get away with it and it does all the things you need it to do, wonderful. If you have to step into the stimulant realm, you have to know the trade-offs, the risks and the benefits, right? Risks are heart rate over time, tachycardia, okay? Headaches, right? Other effects, appetite, right? And maybe irritability even. It just overstimulates you, so you just get irritable quicker. And if your heart is at 70 on a normal, but now it's at 90 all the time, every day, for all the years, you're basically wearing out your engine sooner. Is that the trade-off, right? And then over time, 10 milligrams may not be enough, and then 20, and then 30, and then 40. That's a big struggle too. I'm very scared when I have to go on this ladder because I'm adding more of what you don't need health-wise into your system to get what you need psychologically-wise, functioning-wise, and it's a trade-off, always a trade-off, right? So, any further questions from that? Yeah. Good question. If it brings up all these misunderstandings in the family unit and the social context, what options do we have? What can we do? We can't control people. We can only influence them, right? We can communicate with them. And hopefully they understand where we're coming from with effective communication. And, you got to pick and choose. In the family context, I think it takes both sides, right? Understanding from both sides, love and patience from both sides, and willingness to be receptive to the conversation on both sides. That's the hard part. The Vietnamese family does not have the easy, like, can I sit down and talk to you? Can I be open and vulnerable with you? Can I really tell you my feelings? You can tell from the chuckle, probably from both sides, parents and children, right? How difficult is that? But that is the magic sauce, right? Create the opportunity for what I call psychological safety. Fear of judgment, fear of misunderstanding, fear of not being heard, fear of, just kind of like criticism shuts a person down, right? So we gotta hear those things in a way that is, I'm really sorry that you've been feeling that way. It must be hard that your effort is defined and misunderstood as lazy. That must be really tough for you to feel. Just saying that alone, You can feel, talk to me. Let's create this space that you feel safe to tell me and I feel non-judgmental, and I will continue to practice that so that we can have a constructive dialogue. We're not going to do this. We're going to build a roof, right? Your ideas, my ideas, and how we work to build this structure rather than just clashing. The expectation not meeting the outcome is where that clashing keeps coming. Yes?
This may be off topic, but does postpartum depression have any like part of this, or is it?
Are you saying postpartum depression can trigger ADHD or
Psychology
Yeah.
as a whole. I think if it's regarding to require psych evaluation, I talked to Dr. Name,
Dr. Lu?
Dr. Lou. I think that would also apply here, but as with ADHD, I might be more of a job. But imbalances in general in mind is what he's looking for.
Yeah, you're asking about like the pregnancy,
Yeah, yeah,
pregnancy
like, yeah,
fog. You know, like after a postpartum, people
Right.
tend to forget they can't.
Gotcha. That's a hormone thing. That's on the,
It's hormonal.
I believe it is on a different level. I believe that's a different level of cognitive functioning. You may have an overlap. You may have ADHD before the pregnancy that you didn't know about. And then you have the pregnancy and now the hormone level's off and now it exacerbates your ADHD symptoms. Some people have like whatever they had before was kind of low and manageable. But then the hormonal shift in the 9 months of pregnancy and then the postpartum hormonal shift again after that. Postpartum depression is real. It is absolutely devastating to the people that has had to make that big adjustment in the hormonal shift and the cognitive functioning and the personality and the mood states, right?
And taking care of a kid.
Taking care,
Take care of
right. You know, even on none of those things, taking care of a kid is already stressful. Now add on the emotional burden and the layers of feeling depressed, feeling tired, and not energized, and not motivated, and just having constant thoughts of like, maybe I'm better off dead. Real thoughts, or maybe I'm better off without my baby. Those are real dangerous thoughts, right? So having good mental health awareness and being okay with seeing the doctor, you know, do I look scary? Would you want to come and see me? Or do I look scary and you wouldn't want to talk to me? Hopefully, hopefully more than half say okay. So being allowed to take care of yourself and being okay with talking to a professional about it if you notice the difference in you is important. Allow for yourself that opportunity. Life is short, okay? Take care of yourself. Yes.
Question, so young kids are naturally have a lot of energy, and sitting down at schoolwork is not as fun as playing with friends or playing stories. So where do you make a distinction of something of like raise the level of something like ADHD or learning signs? Or
Good question. So the level of energy of kids and the level of attention span of kids and the level of discipline in kids all come into question, right? How do we make that a good long-term habit? That's what I'm hearing, all right? Good habits requires consistency, discipline. Atomic Habits talks about, instead of the goal setting and everything, you get caught up with that. You'll lose who you are as an identity. Instead, work on your understanding of who you are as an identity and then your habits feeding into that identity, okay? The long way to answer that is the moment-to-moment decision that you help the child to do and you yourself do as adults. I know plenty of adults that need a lot of habits correction, right? And how we get to that is important to have long-lasting positive effects. So if a child is, I'd rather go watch that TV. I'd rather play on my phone, right? What is the collaboration in the parental role to facilitate a balance in that? Of course, we all want to watch TV or doing whatever else that raises our dopamine level without having to do the work. No one wants to naturally sit down and do 3 chapters of math when they could do, 3 hours of whatever show of choice, right? How do we prioritize systematically to enhance the habit of, work before reward? You have to understand the circuitry of habit forming. This is the formula for habits, the habit loop. You have a cue, which is I see someone playing games, or I see that my Nintendo is right there. You have a craving. I kind of like want to turn that on and play. I see my phone. I want to go for it. I want to look up what's next. That makes me feel activated. Then my response, I'm going to go grab it. I'm going to turn it on and play. And then I get my reward. My dopamine hits, right? So if you keep doing this, I walk by a liquor store. My mouth salivates because I want that drink. I go in and buy the drink. I drink the drink. I feel the drunkenness. I like that. And it's a loop, right? So this loop is what you have to know before you take it out to tell and work with the child of discipline, consistency before reward. It's nothing wrong with playing the game if you can build into the balance of doing what needs to be done first. Give me a second. There's a book to teach that. Grit by, I forget her first name, but last name is Duckworth. She talks about the genius, natural intelligence of a person has this much on your success if you don't develop the important parts of personality of putting this time in. Consistency, resiliency, and discipline. Do the work, do the work, do the work. Show up and do the work, okay? That will win over time still. And so how you get that grit is, figuring out each part here and knowing how to form positive habits and how to make negative habits extinct, okay? Positive habits require obvious, accessible, easy, and satisfying. Negative habits to make it invisible, unattractive, and difficult to get to, and make it unsatisfying. Okay? So if there's something you want change in you, there's this habit. I keep doing that, and I don't want to do that. Look at and identify how to break the habit. If I don't want to eat, if I don't want to drink anymore, I got to make the alcohol invisible. Get rid of it. Get rid of it, okay? I got to make it unattractive. So I cannot have this sense of like, it feels good, however I do that, okay? And then I gotta make it difficult to get. I gotta put my wallet over here, and I gotta be like, live away from all the stores, and I gotta not be with friends who drinks and all that stuff. And then when I am really struggling, I gotta take a medication that when I drink alcohol, it doesn't give me the buzz. It doesn't give me the good feeling. It dissociates between action and reward. I don't feel the reward, I won't do the buzz anymore. So long way of answering it is, got to know the habit loop and teach the kids to not get stuck in this loop in a way that keeps on happening, and then you can't get unstuck out of it. Yes, Kevin?
Yeah, it's, in all honesty, as someone who's lived through this, as ideal as it all sounds, it's still, you have to realize it's extremely hard. Because dopamine isn't always like, it's used in literally every part of our brain, and merely completing the task releases dopamine. However, since I have ADHD, it does not release enough. So when you complete the task, you feel satisfied, right? Like then you completed the task. Oh, it's going to lead to something that's good. Like I did the dishes, that means I did the dishes. But whenever I complete the task, it's like I don't get that satisfaction. There is no satisfaction. So why should I do it? And that's another reason, because there's a part of your brain that says, like, yes, I should do it, because then it cleans the dishes, you don't have to do them later, it won't be sticky, it won't be, it all these sort of things. But there's no satisfaction at all. Like, nothing. Sometimes. And that's what I feel on an everyday, day-to-day basis. That's one reason why games tend to be a lot more savory in a sense.
Yeah, well, if you're going to compare like cocaine to like, regular whatever, yes, you're going to artificially increase the amount of response you get from that. But if you do cocaine every day, You already know the outcome of that. And do you want the outcome of that?
No.
Right? Then you have to know that what is worth it to me is always a risk and a benefit to the choices. And you got to know the unsavory, boring parts of dishwashing, right? To offset the risk of, having your nosebleeds all the time, having your heart pounding until you have a heart attack, and then having all the other social aspects of your life being broken up, right? So the things that people remember in the addiction cycle is the dopamine release, but forgetting about all the social negative consequences and the health consequences of what happens if you do that. So you got to know, are you in the mindset of this is not good for me? It's a bad thing. And I want what's good for me, the good thing. And how do I get there? And how do I work that with the specialists that deals with addiction, that deals with discipline, that deals with, long-term behavior kind of thing. All right. What are the barriers? Những cái gì nó cản trở mình để mà mình có thể nói được những gì mình muốn nói. Và khi mà mình nói lên, người kia không đồng ý với mình và cãi mình, thì mình phải dùng những cái như là agreement, đồng ý với nhau như thế nào, thỏa ước như thế nào để mà hai bên đều có thể là có một cái nơi, again, psychological safety, một nơi mà mình cảm thấy là hai bên đều có thể có được lên được tiếng nói và không bị đè xuống hay là reject hay là từ chối ha. Mình có vài cái communication tips để mà cho biết nè. This is a big one. 4 agreements. Có ai coi Dr. Lưu YouTube chưa? Chưa phải không? Okay, watch this on the YouTube after, but I'll say it here again. This is my mnemonic for the 4 agreements. Để nhớ nha. Be impeccable with your words. Say what you mean what you say. Be very careful and articulate and mindful of everything that comes out of your mouth. Not only to other people, but to yourself. Meaning, don't say, you're such an idiot. You don't even know what you're doing. You're so stupid. Do not say that to yourself. Be impeccable with your words, right? Think about what you're saying to other people and to yourself and really work on the precision of the words. It really teaches you to be mindful of your thoughts and how they come out in your expression. Do not make an assumption. We already know that. I thought you said this. No. I thought you meant that. No. You thought, right? Do not make the assumption. How to help that? What I'm hearing you just said is, and repeat. If you don't know, repeat verbatim. What I heard you just said was that, this and this and then that. Is that correct? That clears up and affirms for the listener and also the speaker, both to be on an agreement that we are talking about the same thing and we're understanding the same thing. That doesn't lead to misunderstanding. Don't take it personal, okay? Oftentimes, when someone says something mean and hurtful to us, directly attacking us, it's obvious we're going to feel hurt by it, and we feel very attacked personally. You just said I'm fat. You just said I'm stupid. You just called me a bunch of names that I'm very sensitive about in my own development that I'm very scared about, and you just called me out on it. How do I say, don't take it personal? It's okay. How do I do that? That just really hurt to hear. The way to conceptualize it and practice is whatever they just said is about their personality and their own journey of projecting what they are feeling and how they are still working through that in them. Does that make sense? A person who is perhaps struggling with security, struggling with sense of control, now says all these things to you to feel overpowering to you and easing their own anxiety and insecurities to just feel like, yeah, I got him. You see that? They broke. I got him, right? That feeds their own stuff. It didn't feed anything for you. And especially if you give into it and taking it personal, you just reinforce that pattern. Okay? You got to work on what you can control. I can't shut anyone down saying anything negative to me. Pope, Mother Teresa, Dalai Lama, good luck, right? They all still get it, right? You work on yourself. what you can control, what you can influence. And I will not choose to take that personally. I hear that and I leave it at that, as this is the person's journey and where they are. All right? Always do your best. Meaning, holding yourself to all the standards regardless of the circumstance. Your best on the day you're still struggling with COVID, I understand. You're just trying to get out of bed, eat a meal, and rest and get off that fever. All right? Your best on a day that you ate well and you slept well and there's no stress, there's more to be applied to how to function on that day, right? So self-advocacy begins with knowing how to have a dialogue with a person, how to have a productive dialogue in group setting. This works for me in a workplace of 30 people talking about difficult topics every day. Just because I have a great workplace with great coworkers doesn't mean I don't disagree. And I got to know how to disagree functionally, effectively, and collaboratively. And this helps all of us. We often have to remind ourselves, full-grown adults, hey man, watch your words, right? You got to work on that. And that is in the same thing with family unit. How do we communicate with our children? How does children get to communicate to parents using this as the basis? The 4 horsemen, Apocalypse. This is from Apocalypse. John Gottman. He started out as for couples, husband and wife, but it applies to us talking on one-on-one as 2 people, and also as co-worker and other environment as well, how you dialogue with a person. And these are the 4 ways of talking that will surely destroy a relationship. So much so that based on these 4 alone, he can predict over 90% accuracy of divorces just by the behavior of how a person talks to another person. He puts you in a room, they call it the Seattle Love Lab, husband and wife in a room, talk on a difficult topic, money, children, whatever, for 30 minutes. Sometimes he just turns the volume off. He doesn't even need to hear what you're saying. He just looks at what they're doing and he could still predict, because there are certain things that we are so doing it automatically without realizing that we're breaking the communication apart, and we're really not going toward a constructive advocacy channel kind of deal. Criticism. Imagine if you and I are trying to solve a problem and I start out with, you're so stupid. You never do anything right. You're so dirty. You don't wash dishes. You live like a pig, right? How does that facilitate a mindset of let's talk on how to solve a problem, right? You start, boom, heavy, harsh, and you just laid in a cannon into them. I know I wouldn't want to talk to you to try and solve anything after hearing all that, even though it may be the problem I know that I need to fix. It builds up a lot of defensiveness. It's not me. It's all this other stuff. It's not my fault. It's something else. I'm just going to keep finding excuses to just say, stop attacking me. Natural instinct to just not be feeling like overwhelmed and criticized. This is a big one. It took me a while to understand this contempt. Contempt, sarcasm, a sense of dismissive and disrespect for the person that you're supposedly spending the rest of your life with, from his work as a couples counseling. But it also goes into the normal setting. If I'm talking to you and I'm like, doing the eye roll and doing like, just really disrespectful body language kind of thing, it says a lot even without saying, right? The 70% of what we are communicating is nonverbal. How you sit, right? If I'm talking to someone and they're telling me what to do and I unconsciously sit like this, means I'm in a defense mode. I'm not listening, right? How I look like that, or how they're in the class and they're just fidgety and anxious or body drooping, eye contact not there. All those things are telling me something, right? And the contempt is a big deal because it's almost like I don't really value what you have to say and I disrespect you for who you are. And I'm just going to give you this F you in a way that my body doesn't verbally say, but it'll say it. in a nonverbal 70% of the time way. You'll feel it. You know I'm not wanting to talk to you and I'm saying F you in my head, right? That's scary, right? But that's a really huge breakdown. And the last is the stonewalling. Big old wall. You over here. Whoever you want to talk to over here, right? Okay. I'm done talking to you. Talk to the wall. Talk to the hand. Done. Shut down. Finish. No more. All these three finally led to enough is enough. Okay? And imagine in a family unit, husband and wife, or parent to child, still facing this. Right? Listen to the conversations that you have. Did I just shut down from my parents? Or did I just went on defensive mode? And did my parents just went totally into critical mode without offering a psychological safe space? And did we have a framework of 4 agreements for us to have a normal dialogue? This is what Vietnamese needs to work on. We don't do this, right? I drill this into everybody because it works for me. It has finally worked because I practice it at work. I practice it with my friends. I practice it in all kinds of groups. I've done medical missions, right? Or in the Navy, right? In residency, big teams, making big decisions. You got to know how to work through your problems to solve the bigger problems. It's not about your ego, right? Let go of that, right? That's the big part. Always too focused on the ego attachment, rather than solving, the bigger underneath. What is your goal at the end of the day? You're going to berate your child and just tell them that they're not worth it and you got to do what I tell you to do? You think you'll get your way? You think you'll get the result you want, right? So I often say, if the parents are complaining, I often ask, what are the parents doing? I need to ask that. What is the mindset? What is the framework? How is this working in the family unit? How have you been raising this family through not judgmental, but just understanding the way that it has worked or not worked for you? And then we can work up to, let's get this conversation in a healthy collaboration. Okay? I don't know. There's another one that I like. Oh, sure, we'll do it. 5 dysfunctions of a team. It's intended for more corporate stuff, but the guy just got it all from psychology, and it works perfectly in your family because your family is a team, right? And what are the main ingredients that you need in a team to work? And if it's missing, it would lead to dysfunction. So what are those 5 ingredients, and where does it start? From the bottom up, what does it need? Start with trust. If I can't trust you, I'm not going to be able to really communicate what I want to say. I hold back. I can't say it all, right? Can we create a safe environment enough that I could feel like, Mom, I messed up. I should have told you this sooner, but I really messed up. Or I really don't feel like that's the way we should do this. Can I trust you to tell you why I disagree with you in a respectful way? Being impeccable with my words, right? And I won't take it personal, but I can communicate what I want to you because I'm trying my best to do that. And it needs trust for us to do that, right? Next is, once I have the trust, I can communicate. I can say what I need to say, right? And if I say that, let's work on committing to the one decision to solve the problem that we want. What are we solving here? What are we trying to address? Address the problem, not attack the person. We tend to attack the character of a person. Instead of addressing the dirty dishes, we say, you're a dirty person. You're a lazy person. No, we're talking about dirty dishes. Stay with the dirty dishes. How do we come up with a game plan to get the dishes done? What do you need to do? What do I need to do? How do we do that in this context without hitting all these 4? Okay? Dishes, not the person. Then you hold each other accountable. Did you do that? On Tuesdays, that's your day. Didn't we agree to that? Did you do that on Tuesday? Can we hold each other accountable to that? Then you'll get the results you want. Okay? Cảm ơn chú cho cái lời bổ túc đó. What I think I heard is have understanding and patience and sympathy and recognizing the generational differences in how one had to solve problems in different times and era. I agree. Growing up in a traumatized, war-torn era and knowing life and death decisions and the needs of every day kind of shapes your thinking differently of what is safe and how they think of safety. And how their best intention to you is for your safety, but you're hearing it as, oh my God, you're worrying about everything, right? So really good point that there is truly a, I mean, imagine if you were a young adult in the 70s and then you're in the young adult in now, the 2020s, and 50 years has passed, and the kind of life that this person has had to endure prior to that, right? 1954, I'm just barely learning all the history timeline, right? The last of the French, and then 60s, when the war escalated. How many years did we actually have any time of like non-war in between? And how much of this was all war still? And how much of that after, since, is really us here, family or friends, or however the country is living there? Is it still an us versus them? Is this still a you versus me? Or is this a me understanding myself in the context of who I am, of all this, so that I know my strengths and my areas to work on? I think at the end of the day, it's, self-awareness, humility, and willingness to change from the inside of us, rather than saying, you guys are the ones that need to change and my life will be so much better, right? Yeah, great question. It's about who we are, what defines us, and how do we have still the space of flexibility and communication and receptivity. Let me finish with this thought first. I think I was still in the middle of, I think understanding the diagnostic background, there may be something to a person that is traumatized and then feel like they have to have people agree because they came from a world that they made a mistake somehow and it did cost them dearly. And now they live in a world of, I only expect yes. I don't expect challenges because it costed me something in the past when that happened. Having the context of that in place perhaps can then bridge the, I know where you're coming from both sides, to then have an open dialogue about it. It's not always obvious, but when you listen to the person, you're saying, tell me about why this is so important to you that you have to have them agree with you. What is it underlying that makes you feel like it has to be this way, right? Understand the personality, the preference, the controlling aspects, right? Underlying the control, there is a positive need for that reason of needing control. What is that, right? Maybe the parent's intention was protection. It comes out in the form of control. In the child, it's experienced as, you don't care about who I am, right? So how do we bridge that is understanding what else can serve the purpose of protection without applying the pressures of control in a way that is non-productive. On to Timmy, habits. I think what I'm hearing is you're saying it's so boring to do this again and again and again. And then how do you fit in the novelties, the excitement, the adventurous, spontaneous parts of life? Is that what I'm hearing? Okay.
Not as in life, like just all experiences, but like taking like this risk and like building a career or something.
Yeah. I don't think it's a mutually exclusive that you can either only be a novelty seeker or a habit performer or a habit doer. Both can coexist, right? Your daily things that keeps you maintain functional orbiting and in the way that is productive and always I think I guess like okay, for those who know me, it's what's the next new thing? Timmy's known me through the years. It's like it's either cooking or pen making or this stuff and that stuff, and now it's the latest is just having fun with the YouTube in sharing this knowledge with people, right? There's always that one novelty thing that I'm doing, but underlying all that there is a pattern of consistency of how I produce that and maintain a full-time job and raising 4 kids and having time for my own traveling and development, and so that there's a balance, right? There's always got to be a balance, right? Biopsychosocial, that's one. And then there's a balance of roles of who you are. Me as Lou, me as husband, me as dad, me as son, me as doctor, right? Know the roles that you play and know the balance you need to have. And any one of these kind of thrown off will kind of be signals to you that, am I really living a full, authentic, genuine, fulfilled, rewarding, meaningful life, right?
We are at time and we need to go. So thay mặt lớp, we cảm ơn bác sĩ Lữ nhiều nói chuyện với lớp. If we love this and we'll have other opportunity to bring him back and other people back. Cho nên Bình hỏi mình vỗ tay cho bác sĩ ha.
Okay.
What else can you guys do? What else can you guys do? Nói cảm ơn together and then we can subscribe to his channel, right? Rồi, 4,
Right.
2, 3. Cảm ơn bác sĩ Lữ. Okay.
Baxi Lou or Dr. Lou. That's all you have to do to search on your YouTube and you'll find me. Okay.
Cảm ơn bác sĩ Lữ.
Yeah, thank you mọi người nha. Thank you for the opportunity. I really appreciate it. Okay.
Rất là nhiều